Now you're on.
All right,
You
so
just
what am I
pointed at
doing?
me. You're
Okay.
on. You can see me, right?
Yeah.
Okay, good.
What am I pressing?
Nothing. Just hold it. Sit all the way in the back and hold like that. This way you get tired shoulders.
How long am I doing this?
Huh?
How long am I doing this?
Do it for 10 minutes.
Oh,
Well, how long do
10
you
minutes.
hold your shoulder? I'm just kidding. Just do it for a few minutes.
Okay.
And I'll get somebody else to do it.
Okay, got it.
So let's talk about the pathogenesis of cumulative trauma disorder, because I think that's something that we see all the time within all our patients. I think it's probably the #1 reason that people come into our office. Cumulative trauma. Let's be reasonable. There's two things that are going on. People either have an initial trauma, they fall, they hit something, and that's one reason they come in. But again, the pathogenesis of cumulative trauma. Now, what's most interesting about it is here you have the frequency of insult. Now you have a recovery cycle. The patients have ample time, or what they think is ample time, to recover. They're below what we call injury threshold, meaning they don't complain about anything. So as you see, they go under the bar. I will say to you that even though in that particular graph, they say it doesn't hurt, there's still an issue. And the issue could be movement. They could have aberrant movement because of that recovery cycle. Now let's go to the bottom half of the slide, and we look at this injury cycle here. Now we have insufficient tissue recovery. There's not enough time. So the tissues don't heal. They go above the bar, and it hurts. And then they come in and see us. So the big takeaway here is, one, cumulative trauma disorder is a key component that everybody's going to see in their office. And number two, if it doesn't hurt, it doesn't mean the person's healthy. And it doesn't mean they're moving well. If you're relying on the patient's pain or pain analog scale, even though that is an indicator, you're going to be chasing the pain, and the patient has all the control. If you're looking at movement and functionality, the doctor's in control, and we're looking at higher level healing. Is it constantly avoiding pain a healthy way to live? Yeah, well, it hurts a little bit. No, clearly not. I want to be pain-free and fully functional. Here's one of my big takeaways about integrating the laser into a practice. Everybody always asks me, well, how do I pay for the laser? How do you not? If I have it, or if Dr. Smith has it, or Dr. Doe has it, and they're treating people and getting results, how do you compete with that? It's very difficult. So when people ask me, how do you integrate laser into practice? Well, look what Dr. Oz says. If Dr. Oz says it, it's correct? That's what your patients tell you. Oh, Dr. Oz said that, it is correct. It's the no-pain pill buster. The man didn't go to Harvard and University of Penn because he wasn't smart. It's a great takeaway. The no-pain pill buster. One of the leading health authorities in the United States and the world. I like to think, little old me, I called it the most versatile healthcare tool of the 21st century because of all the different things. It is sort of your gateway to healthcare. You know what? Life is really simple, but we insist on making it complicated. Let's just keep it simple with our patients. Let's explain what it does, and let's have our mission in place when the patient gets there. We want everybody to get better, but we want everybody to move better functionally. So what's your blueprint? What do you do? Well, one, find a cause. Grandma told me. Grandma said a good doctor helps the pain, a really good doctor finds the cause. Third grade education, but she got that one right. So I listened to that. Secondly, explain the source. Students say, what class should I take when I graduate? Learn how to communicate, brother. Because you're going to be talking, touching, writing, videotaping. Explain what's going on. The biggest arguments against a lot of other fields is they spend no time. They don't tell me. They walk in and go, did they tell you what a herniated disc and a bulging disc is? No, it doesn't sound good, right? Explain the problem. That's our big advantage. Those who use a laser are touching people. So we have the opportunity to explain what's going on. Let's determine effective treatment. Clearly, laser would be one of them. And let's shorten the treatment time. Laser is going to help you shorten the treatment time, plus other things that we're going to show you today, proper rehab, taping, and the like. I have a question for everybody here. What happens to movement after injury, since I'm all about movement? What is it about pain that changes the way people move? Or what is it about the way that people move that causes pain? Sort of a chicken or the egg question. Which came first? I'm not really sure. Injury or pain? I know one thing, the common denominator is altered motor control. So this is what we should diagnose, and that's a fundamental question that everybody should be thinking when a patient comes in with altered motor control. And obviously the laser will help you with the motor control.